Module Overview. To consolidate, assess, and synthesize all knowledge gained throughout the course. Equip you with the critical thinking, scenario-based reasoning, and confidence required to pass certification exams, handle real-life emergencies, and operate in accordance with international resuscitation protocols and ethical legal standards. Purpose of Final Review. This concluding module serves as the culminating platform for reinforcing and applying theoretical knowledge gained across previous modules. It ensures that students fully understand the CPR-AED-BLS workflow, can confidently recognize cardiac arrest, know how to make critical decisions under pressure, can document actions legally and ethically, are ready to pass international certification exams, e.g., AED-BLS, ERC BLS. Section 2. Drowning Victims. Mechanism. Oxygen deprivation due to submersion leads to hypoxic cardiac arrest. Key adjustments. Remove the victim from water quickly, but safely consider personal flotation devices and spinal precautions if diving injuries are suspected. Start rescue breathing immediately while still in shallow water or as soon as on firm ground. Provide 2 initial breaths before starting chest compressions. If alone, give about 2 minutes of CPR before leaving to activate EMS and retrieve an AED. Why rescue breaths first? In drowning, the primary problem is lack of oxygen, not heart rhythm disturbance. Ventilation reverses hypoxia. Diagram suggestion. Flowchart showing drowning CPR sequence. Case study. During a lifeguard shift, a 14-year-old boy was pulled from a pool, unresponsive and cyanotic. Immediate in-water rescue breaths restored spontaneous breathing before EMS arrival, demonstrating that rapid ventilation is life-saving in drowning cases. Key summary of core concepts. Modules 1 to 9. CPR fundamentals. Recognizing cardiac arrest. High-quality chest compressions rate, depth, recoil, minimal interruptions, proper hand positioning and rescue breathing. AED essentials. When and how to use an AED pad placement for adults, children, and infants. Interpreting shock versus no shock. Post-shock protocols. Basic life support sequence, CAB-D. Circulation. Initiate compressions. Airway. Ensure patency. Head tilt, jaw thrust. Breathing. 2 breaths after 30 compressions. Defibrillation. Use AED as soon as available. Legal, ethical, and documentation obligations. Implied consent and Good Samaritan protections. DNR. Advance directives and refusal of care. Real-time documentation and GDPR/HIPAA standards. Integrated real-life scenarios. Scenario 1. Cardiac arrest in a public mall. You find a middle-aged man collapsed in a shopping mall. You confirm unresponsiveness and abnormal breathing. Bystanders are unsure what to do. Application. Call for help. Activate EMS. Begin CPR immediately. Ask someone to bring AED. Attach AED. Follow prompts. Deliver shock if advised. Continue compressions until EMS arrives. Scenario 2. Infant unconscious at home. A parent calls out. Their 9-month-old baby is unresponsive and not breathing. You're the first responder on scene. Application. Check responsiveness. Begin 30 compressions with 2 fingers. Open airway. Give 2 small breaths. After 5 cycles, call EMS if alone. Use pediatric AED pads if available. Scenario 3. Conflicting DNR orders in hospital. During a code blue, CPR has started. A nurse suddenly finds a DNR document in the patient's file. Application. Immediately halt CPR. Verify the DNR authenticity and scope. Document the incident accurately. Notify attending physician and ethics team. Scenario 4. CPR fatigue among staff. In a remote clinic, CPR has been ongoing for 20 minutes. Only 2 staff members are available and both are visibly exhausted. Application. Switch compressors every 2 minutes. Call for additional help. use mechanical compression device if available, evaluate for termination of resuscitation protocols. Practical exam and certification preparation. To ensure readiness for formal certification, AHA, ERC, etc., you should prepare by reviewing visual aids and skill videos, practicing compression and ventilation ratios, memorizing the steps of the BLS algorithm, taking mock exams with scenario-based questions, attending a hands-on skills session for validation, certification bodies and standards, MET, Organization Standard AHA, American Heart Association BLS for Healthcare Providers, ERC, European Resuscitation Council Basic Life Support Guidelines, UK Resuscitation Council, Level 2, BLS and AED Training ISO 21001:2018 Educational Organization, Management ISO 45001:2018 Occupational Health and Safety, WHO Guidelines COVID-era CPR adaptations. Learning outcomes for Module 10. By the end of this module, you will be able to recall and apply the entire BLS process from initial response to AED usage, evaluate and respond effectively to complex emergency scenarios, demonstrate legal and ethical awareness in resuscitation situations, accurately simulate documentation and post-resuscitation reporting, prepare confidently for practical skills assessment and certification exams.